We're seeing more new referrals, people who previously didn't have mental health problems.
A second pandemic.
I have struggled a lot throughout this whole year. Am I going to be infected? Are my people around me going to be infected?
A mental health crisis triggered by COVID-19.
Since that first lockdown, what we've seen is a sustained increase in demand on our crisis lines.
A surge in cases, pushing a struggling system closer to the edge.
For one reason or another, this young person had decided enough is enough.
We are hearing that people are self-harming more.
A COVID legacy that will impact lives long after the pandemic is over.
I am worried that we will see repercussions of this for years to come.
How long have you stopped your medication? 2 days, that's not too bad. But please, as promised, continue taking your medication. And apart from this current situation, any other stressor you've got?
The calls keep coming. This mental health crisis line is manned 24 hours a day, 7 days a week. It needs to be.
One of the support is your medication, which you require to help you to feel better from your depression, and for you to look into what makes you feel better and what makes you feel happy, so we can support you to attain your goals.
We work in crisis care, so our job is looking after people when they're going through mental health crises, and we look after them at home. So we deal with people really at quite a vulnerable point.
Dr. Derek Tracy is the clinical director for Oxley's. He's responsible for adult mental health in Bexley in South East London.
We are seeing more people contacting services who have no past experience with mental health care. People's stresses are up, people's resources are down. So the things you might do to help with that ordinarily, maybe you go for dinner with friends, you can't do that. And then the services, when you go to contact them, are really busy. So we're stretched.
Your voice can sound a little bit more.
Dr. Tracy's team are continuing to support vulnerable people in the community. It's to help them before they reach crisis point and need admitting into hospital.
I do think we're going to have a surge in the coming months. I think what's really hard to see is how long that's going to last and how deeply it's going to last.
We've been given rare access to the wards of a mental health unit and to the teams of dedicated staff who have worked through this emergency. How rare is it for you to have an unoccupied bed?
We always run close to full capacity, and that's something that is been the case before the pandemic. That's not been altered. In fact, at the start of the pandemic, we had a push to try discharge as many people as we could out of an anxiety that this would be an infection hub for them.
This adult mental health ward is almost always full. But the numbers of patients being admitted here fell during the first wave, but they are rising again. Many campaigners have warned that Britain's mental health services have been neglected for too long, through years of underfunding. If the threatened explosion in mental health cases does happen, it will push a struggling system closer to the edge. Here in South East London and Kent, they are beginning to see the start of this surge.
Since that first lockdown, what we've seen is a sustained increase in demand on our crisis lines. They're still running about 30% above pre-pandemic levels, but also more and more people through their GP asking for access to psychological therapies. And our demand for that is up around 280% compared to pre-pandemic levels. What we've got to do is make sure that we distinguish between the natural response of feeling as though this has been difficult and people who, through their own resilience and through the support of their friends and families, will recover. And then those people who become unwell and who need the help of the NHS with that. And that is the group of patients we really need to think about at the minute and how we resource that.
Successive lockdowns are taking their mental toll. Not surprisingly, the stress of isolation, compounded by anxiety over job losses and the uncertainty over our futures, is to some extent affecting us all. But some people will get support from family and friends once the restrictions are eased. Others might not be so resilient. Dina will be looking out for these people, using her own experiences to help others struggling to cope.
It's been tough, like with my own mental health, and obviously dealing with other people's mental health.
Dina works for the mental health charity Mind, which in partnership with Oxley's provides community-based support.
The uncertainty about what's going to happen next. Is my job safe? Am I going to be infected? Are my people around me going to be infected? What's going to happen? Like, there's so much fear, and that's kind of played a part in my own anxieties and how I'm going to cope day to day.
Dina's mental health struggle began when she was just 13 years old. She's been getting much better, but last July went back on medication. This pandemic is affecting people with a history of mental health problems, but also others who are experiencing issues for the first time.
We see people from all walks of life. There are people that have come through to our services who have no experience with mental health difficulties. It's all completely new to them, and like suddenly their whole world has changed. And they're coming to terms with that as well and plucking up the courage to be able to ask for help.
The first person emailed in to say, as we're nearly a year into this pandemic, and whilst we have a vaccine and infection numbers have started to fall, I'm finding life particularly hard at the moment.
The pandemic has forced mental health service providers to adapt. This therapy session has moved online. Here, people who were once service users have retrained to become counsellors, like Joanna, working alongside therapists like Neil.
Many people who have severe anxiety, depression, or any of the other conditions like personality disorder are used to coping with quite difficult things. So actually they coped really, really well in the initial phases. But as things have gone on, the level of isolation, the level of disconnection from routine, all of these things are just really accumulating. Anecdotally, we are hearing that people are self-harming more, but people are just using anything to just try and manage thoughts and feelings that they would normally do through just being with people, you know, and of course that's gone.
Do you tell them what your experiences were? Or do...
Yeah, I can do. I'm quite selective. It's knowing that you can have this feeling and there is another side to it, like it can go away and things can improve. So when you're, when I was particularly unwell, I don't like that phrase, but when I was particularly unwell, it's really difficult to hold on to any sort of light at the end of the tunnel. You think that is it. You think this is the way that life will be for you now.
The Centre for Mental Health warns that up to 10 million people will need mental health support as a direct consequence of COVID-19. Alarmingly, 1.5 million of these are expected to be children and young people under 18. Peter, and this is not his real name, is a schoolboy from London. He tells me he's had some issues with his mental health in the past, but the pandemic is making his obsessive-compulsive disorder worse.
If you have a compulsion that just simply involves door handles, but the pandemic, the issue with the pandemic is that it kind of gives you more time to think things through. And because of that, you start to maybe think, maybe there's something wrong with light switches as well. And then all of a sudden, it's like you've got little things popping up here and there. And then if you're not able to stop them in their tracks early on, they can develop further and become worse and worse.
Have they developed further? Have they become worse?
In my case, I would say yes. However, I'm working with my clinicians and hopefully we can come up with some sort of plan. Now, because of the pandemic, I haven't got anywhere to go. You kind of get more time to play with your own thoughts, and because you have thoughts popping into your head, you don't really get a chance to combat them.
And does that lead to you being overwhelmed with these thoughts?
Yes, it leads to an overwhelming sensation, and then that's what then triggers the compulsion.
Dr. Omar Mughrabi is Peter's consultant. He told me he's seeing a sharp spike in cases, and some were very worrying.
We've seen an increased amount of activity within our crisis services, whether it's by telephone or via our crisis line. Their numbers of people they've spoken to has skyrocketed in the last year or so. And we've been extremely busy in the A&E department of young people that we're seeing in there. I've seen a couple of young people who've presented to A&E who have taken overdoses, who've cut themselves severely, some who've changed their patterns of eating so severely that they've lost a lot of weight, that our colleagues, medical colleagues, are treating them medically in order to save their lives.
What's driving this?
One can only say the major factor across all of it is the pandemic.
It's not just the young who are affected, the elderly are particularly vulnerable too, with some clinicians warning of a trauma time bomb.
It's the same as everything else. The longer you leave it and the worse it's likely to get. Now that's true of cancer, but it's equally true of mental health.
This is exactly what Dr. Fadipe is seeing in her ward. She specialises in the care of elderly patients with dementia. Even inside here, the effect of the pandemic can be felt.
During the first wave, I think families were a bit worried about people coming to hospitals. They're presenting themselves now. We've seen an increased referrals, and we've seen that people are much worse.
And it's this pause in seeking treatment that will have serious consequences.
Any kind of intervention that we would have put in as an early intervention then doesn't work, so you need to use something different, which means they may spend a longer period of time in hospital. You may have to use more medication than you would have usually used, and they may lose the opportunity to be able to go back home.
How worried are you about the long-term impact of the pandemic on the mental health of elderly patients with dementia?
The prevalence of dementia was increasing anyway due to various factors, but isolation leading to low mood and depression can be a precipitator for developing dementia. A lack of activities, which we've all seen in lockdown, can lead to or can precipitate dementia. So I am worried that we will see repercussions of this for years to come.
This stark warning from Dr. Fadipe is being sounded by other mental health care workers across the country. Britain's mental health crisis is in danger of becoming a legacy of the pandemic.
I don't think we should rush too quickly to try to decide what impact lockdown and pandemics had on people's mental health. We need to give the staff in the NHS who've been through a lot the time to talk about their experiences and absorb that.
What we've all experienced, a lot of problems will go underground and will manifest a bit later.
I'm optimistic that in a post-pandemic world, a lot of it's going to settle down. But I think there are some people that this is going to be a problem that they're going to carry with them through their lives.